I want to go to skin cancer, which we're hearing a lot about it, especially us that we live in South Florida,
Yeah.
and all the time we're talking about protecting yourself. Reconstructive surgery after skin cancer, what are some of the procedures you do in your practices for patients with skin cancer?
Yeah, there's a huge range of skin cancers. They're very, very, very common. Non-melanoma skin cancers being the most common, squamous cell carcinomas, basal cell carcinomas. And it can be as simple as you just cut it out and close the wound, and you have a little linear scar. Or if the defect is bigger, then we have to move some local tissue around. We do one of those local flaps that we spoke about, and or skin grafts are very common for these cancers. And there are some cancers that, if neglected, will grow and invade underlying structures and need big reconstructions, like the head and neck patients, or the lower extremity patient we spoke about was a squamous cell cancer in the foot that was just ignored for many, many years, and it got so large that it started invading his Achilles tendon, and things that needed more sophisticated reconstructive procedures.
And we have a 3D image of, I believe, a stage 3 basal cell carcinoma, and the doctor's bringing it up now. Let's talk about what this is and how you come in to help the patient here, doctor.
Yeah, this is a basal cell carcinoma. It's the most common type of non-melanoma skin cancer, the second most common being squamous cell carcinoma. They start in the basal layer of the skin, and then as they grow, they tend to invade locally. This is not a cancer that typically metastasizes or goes to other parts of the body, and they just need to be cleared with clean margins. And if they're in the face, they typically get resected with Mohs surgery by the dermatologist that does Mohs surgery, and it's a technique that allows them to look at the margins as they're taking it off, so that they can spare as much tissue as possible, because as you can imagine, in the face, you don't want to take out more skin than you need to.
Of course.
If they're in the body, you can just cut them out with a 4mm margin if they're a low risk cancer, and you just close the wound. And so it can be very simple or very complex depending on how advanced it is and depending on where it is in the body.